This is the KUSI News at 6:30.
Good evening and welcome to the KUSI News at 6. Alan Denton.
I'm Sandra Moss. Thank you for joining us.
The plan for a longtime San Diego Police Department dispatcher to donate her kidney to a longtime police department officer was delayed today. Dispatcher Deborah Ballard announced last week that she would donate her kidney to longtime colleague Art Calvert, who has suffered from kidney disease for decades. The procedure was scheduled for this morning, but it was called off over concerns that Calvert's body would reject the organ. Joining us now with more on organ transplants is a transplant surgeon, Dr. Randolph Schaffer from the Scripps Clinic. Dr. Schaffer, thanks for being with us. Disappointing for this particular patient, but what kind of tests are done in advance to determine if a patient's body might reject an organ transplant?
Sure. Thank you for having me. It's a long process to test both the donor and the recipient for the ability to donate and receive the organ, and compatibility testing is a big part of that. It actually involves multiple layers. The most common that we think about is blood type, not necessarily being identical or matching, but being compatible. And then the other part starts to get in a little deeper into the weeds with the immune system and the things that make us unique from one another. And so we talk about perfect matches, but nowadays you don't have to be a perfect match with someone to donate. You just have to be compatible. So what does that mean? Most of that has to do with testing the potential recipient to see if their immune system has already been exposed to something that would make them react prematurely and quickly to the organ coming from the donor.
Well, people who do get organs, they're on drugs, medications for the rest of their life, right, to make sure that they don't reject.
That's true. Much of that is trying to block the immune system from responding and reacting to this organ. But sometimes if someone has already been primed against that, think of it as like when you have a vaccination, your immune system is primed to react to that infection if you are exposed. Similarly, if someone has perhaps received a transplant before or received a blood transfusion or in some way been exposed to someone else's organs or tissues or blood, their immune system can form a reaction or response to that. And sometimes if that's a strong response, it can be hard to block even with the medications that we have.
What's the recovery time for patients who do undergo organ transplant surgery?
So at Scripps, which is a comprehensive transplant center, and we transplant liver, kidney, and pancreas organs. For a kidney transplant, our donors typically leave the hospital within 2 to 3 days, including the day of surgery. The recipients of a living donor transplant also often leave within 3 days, sometimes 4, from the hospital. For the recipient, the recovery, though, extends beyond that. Even though they're not in the hospital, they're still recovering from the surgery and acclimating to the new medications to prevent rejection.
I'm always so amazed at the generosity of people giving a perfectly good kidney to somebody. This gentleman rejected 2 of them from members of his own family. What ramifications does it have for the donor?
So actually, the donor goes through careful testing throughout, not just compatibility with the recipient, but also to essentially make sure that they are healthy enough to safely donate an organ, that it's not going to dramatically affect their future health, not just kidney function, but otherwise. Making sure we figure out which is the best kidney for them to safely donate, and making sure that they really understand what they're to do, not just the short-term risks, but the long-term implications, and that they are prepared to make that decision.
Tell us about some of the advances that you've seen over the years in organ transplant surgery.
Well, staying on the theme of living donation, I think one of the greatest advances for the kidney transplant community is in situations like this one. Historically, when a donor would go through testing and would not be compatible, we would say to them, well, we're sorry, you can't donate to this person that you were so intent and hopeful to help. Bye, see you later. And now we have additional opportunities. At Scripps, one of the things that we offer to our patients for the recipient is the opportunity to look at how intense was that inclination to reject the organ, and can we somehow reverse that in advance and allow the transplant to go forward in a safe way? And then the other option would be to say, you may not be able, this person may not be able to donate to the recipient, but we have another pair who's also incompatible. Maybe we can pair you up, and she would donate to someone else in exchange for their incompatible donor donating, in this case, to the office.
Wow, it's quite the web.
It sure
Very
is.
interesting.
Absolutely.
Well, we'll have information on the KUSI website on how to become a donor, and just make sure to fill out that thing on your driver's license, right?
Absolutely, absolutely.
Always looking for donors. Doctor, thank you.
My pleasure.
Thanks a lot.
Thank you for having me.